All right. So I have the pleasure of introducing Noor and in his amazing work um, in emergency room physician as a emergency room physician. So uh, I do need to tell you that in 2021, I had the pleasure of working with Noor as he completed his developing a framework to train community in life-threatening emergencies. And his master's project was amazing. His master's project showed that degree of passion that Dr. Kim or Dr. Red, who this morning was talking to us, says is so essential. And it was so clear that Noor was going to not only make a difference in his country, but be a model for a larger global community who wants to make a difference in the world and in society. So with that, I just want to introduce Noor and please tell us about your work.
Thank you, Sue, for the kind introduction. And I just want to uh, make sure that everybody can see my screen.
Click, it says
If you do,
double click. There you go.
and just want to also make sure to turn on the slideshow, and I hope that everybody can see the slideshow mode.
Not quite yet, but it will. Click on slideshow and beautiful, beautiful.
Right,
So
thanks. And
Nora, before you start, just a couple things because it still is quite at the beginning. I do want people to know that Nora, of course, is a graduate of our program. He will be finished with his doctorate by April. He's already published more publications than are required. And so what's unique is his application, his personal and professional application of his passion and this intellectual scholarship that's grounded in creativity. So just wanted to make sure I said that, Nor.
thank you, Sue. And we'll talk a little bit more about it and the role that the Center of Applied Imagination has played, um, helping me not only to complete my doctorate, but also to help me apply creativity in my personal and professional life as well. Um, so without wasting any time, um, I would like all of you to think for a few seconds and type in the chat box that you need to imagine and type in the chat box what would an emergency room looks like. And you have to defer your judgment for the next 30 seconds and start typing uh, whatever comes into your mind. Mhm. We've got 10 more seconds. 5, 4, 3, 2, and thank you. So a lot of answers come in, and let's see if the next couple of images can actually match your imagination. And I can saw a lot of people mentioning chaos, busyness, noise, a lot of professionals in the room, chaotic environment, and so on. And Let's see if the next image can actually match your imagination. A lot of people in an emergency hallway. You can see a lot of professionals some doctors, few paramedics, waiting for the patient to be accommodated in an emergency room, few doctors and professional staff, and a lot of waiting as well, maybe an overcrowded emergency room. And the next one can actually show a more technical chaos rather than overcrowding. You can see only one patient, but he's fighting for his life, and you can see his soul standing right at the back of the EMS provider doing CPR, waiting to be revived. But that's actually what a resuscitation room of an emergency department looks like when you receive a patient who is critically ill, fighting for his life. So, yeah, your imagination was 100% spot on um, when it comes to imagining an emergency room. So you can see a lot of complex environment, and you can guess that the problems that an emergency physician and emergency staff face is every day are also complex. And we see these problems and we try to solve them naturally through traditional ways. But we know that we cannot solve problems by using the same kind of thinking we used when we created them. And hence, we require creative thinking. And that is why creativity matters in emergency medicine because we work in a high pressure, high stakes environment because the lives are on a stake. We need to solve problems. We need to make we need not only to make decisions, but make quick decisions. So there is a need for rapid, complex problem solving. Not only complex problem solving, but rapid, complex problem solving. And for that, we do not necessarily that needs to stuck to the protocols and the rigid protocols that the medical fraternity is used to have. And we need to go beyond these protocols and strict guidelines and think outside the box and think outside the code blue. And the code blue refers to the code where we need to resuscitate a patient immediately, do CPR and do life saving interventions immediately. So we need to go beyond that rigid framework and think innovatively to come up with solutions for these complex problems. So let's see and let's analyze what's the role of creativity beyond emergency medicine in the canvas of healthcare? What's creativity looks like in healthcare as a whole? Uh, Traditional approach, like I said, follows rigid guidelines and a hierarchical approach, whereas creative approach, as we know, is adaptive, not only innovative, but adaptive as well. We know the KAI index. It requires problem solving and it requires innovation as well. But it has been happening, right? It has been on the walls for such a long time. We know about syphilis, the the death-taking disease that persisted for till 3 centuries, from 16th to 19th century, and it was only till 1945 when somebody thought beyond the obvious, beyond the code blue, and came up with one of the lifetime interventions of humankind, an antibiotic named as penicillin. But before that, for decades, hundreds and thousands of people lost their lives because of syphilis and suffered from a complication called as neurosyphilis. Similarly, the creativity and innovation in healthcare has progressed. Now we see robotic surgeries. Now humans are controlling robots to do precise and precision surgery. Not only that, it also has covered time as well. Somebody sitting in the US may do a surgery of somebody sitting in Dubai through these robotic surgeries and technologies at times. Not only that, through creativity and through creative thinking, the world has overcome complex problems like the pandemic, like the COVID. The humankind has seen uh, a rapid innovation of the vaccine in the history of humankind that saved millions of people all around the world. Similarly, other problems like climate change. In the picture, you can see the floods that Pakistan has seen a couple of years back one of the worst floods in the history of humans. More than 30% of the population of Pakistan was in water. And you can see that it's just a state of one small town. But in 2025, we have overcome that. None of the traditional thinking could have led us out of it. And remember, Pakistan is a lower middle income country, not enjoying a lot of facilities that a lot of high income countries do have when it comes to rescue and disaster management. So it was bound to have creative thinking if we need to come out of that. So the need for creativity in emergency medicine, it's unpredictable. We have to utilize the limited resources we have in a very efficient way and a safe way to improve patient care in emergency medicine here in Pakistan. And that calls for creativity itself because you are now dealing with a lot of complex problems here. This is the WHO framework for emergency care. It has been implemented in a lot of lower and lower middle income countries. And this is the framework that a lot of emergency care providers in more than three-fourths population of the world and healthcare world actually adapt to. And you can see that the emergency care framework comprises of scene, that is outside the hospital where the incident happens, the ambulance, the transport, and then the in-hospital side. And let's analyze what are the core processes of an emergency healthcare system that guides this framework. Knowledge, skills, best practices of healthcare providers, attitudes of a healthcare provider, advocacy, and continuous improvement. So these are the domains that guide this framework related to healthcare providers. And these are the processes. So for knowledge, you need to have quality education for healthcare providers to have sound knowledge of the disease and its treatment. For skills, you need to have world-class training to improve patient care. Similarly, for best practices, you have to come up with best quality research and evidence that can be implemented in clinical practice for the patient's better outcomes. Attitudes. For attitudes, healthcare providers need to have soft skills training beside their core training as well. That is so important these days. We talk a lot about verbal communication and non-verbal communication, but soft skills play an important role in healthcare provider training, and that actually impacts the patient outcomes as well. The advocacy, different rules and regulation and policies that governs an emergency healthcare system, that is important. And for continuous improvement, you have to have quality assurance and quality improvement methods and processes. And all these domains and processes develop a culture of excellence in an emergency healthcare system that has a direct impact on the patient's outcome. Now let's match these core processes that I just mentioned to the creative attributes that we have: education, training, research and evidence, soft skills, policies, and quality improvement and quality assurance. You need to have curiosity when we think about education, quality education. We think about flexibility when we talk about training. We have to deal with a lot of different healthcare providers and teachers with different training resources and environments. So you have to be flexible. You have to make connections when you're doing research and when you're applying that research into clinical practice because not all research is practically applicable. There's a lot of rubbish publishing in the medical world as well. So you need to make connections, what is useful for the humankind that needs to be translated from research into clinical practice. Playfulness. You cannot teach people soft skills by having rigid protocols. You cannot dictate adults about how to speak to a patient, and grade them marks and pass or fail them. So you need to bring playfulness to heighten their anticipation as per the team model to teach them soft skills. You need to defer your judgment when it comes to policies and legal frameworks. You cannot have a single-minded, if you are a politician or if you are at a place where you can make decisions, you cannot have a rigid mindset to an idea when you're making a policy. So you need to defer your judgment. And for quality improvement and assurance, you need to have an ability to glimpse into the future. You need to see beyond what's happening today so that you can actually make changes that can improve the quality of your patient care today. So I will talk about creativity in patient care, medical education, leadership, and community service. So patient care involves a lot of processes involving workflow changes, integration of AI for rapid decision making, and introducing rapid decision making tools as well. Introduction of telemedicine is also a part of improving patient care. These are two pictures. On the left, you can see a portable MRI machine. Now, a lot of patients cannot move to an MRI room or stay there for a very long period enclosed in a big machine. Now they have invented a portable MRI machine which can actually be transported right next to the patient, and an MRI scan can be done. On the right, you can see a mechanical CPR device. You don't need your hands to press a chest anymore. The device can do you a better and can do it better than a human can, whereas it can actually free a lot of human hands to do a lot of other work in this high pressure environment when a patient is in cardiac arrest. This is a picture from Pakistan where there are telemedicine satellite centers catering for child and neonatal health. So Pakistan, as I mentioned, is a resource-limited country. And on the right, you can see a small child being seen by a nurse and a doctor talking on a phone to the satellite center on the left, where the pediatricians are actually guiding and helping this doctor and nurse on a remote area of Pakistan where resources are limited, how to manage this child according to the best practices. These centers are 300 centers all around the world working through telemedicine and virtual connections, available 24/7. Last year, they received 760,000 consultations and saved thousands of children. They thought beyond the code blue. Coming to medical education, we know that innovation and gamification and storytelling, they not only taps your creativity, but also fosters a culture of divergent thinking and problem solving. This is just a collage of a lot of activities at my institution. You can see on the left, um, medical residents, postgraduate trainees involving in gamification and learning urogenital diseases through Lido. You can see a faculty member on the right wearing a mask called as Red, storytelling and teaching students about how to deal with critical life-threatening conditions. We had a lot of hackathons at our institution trying to solve our strategic complex problems and coming up with innovative solutions and having funding for the top three winners and helping them to implement those innovations to help us solve these complex problems. And we also have brainstorming session with the researchers to come up with the most relevant research questions so that the investment can be done into those research questions and come up with some relevant clinical practice innovations and tools through those research. But it requires validation in the medical fraternity. So we published as well. There have been a lot of publications on creativity and innovation in the medical journals in the last 5 years or so as well. And one of our faculty members actually published a book called as the Mad Jack about the creative innovations that we have done over the years at the Aachen University, the place where I work. This is one of the workshops that we did where we facilitated our medical students and graduates and faculty members to actually think about their desired future state and their current state, and then draw their steps about how to take them from their from their current state to desired future state. And it's just one of the example of a participant that I wish to shift the paradigm of Pakistani life-saving trainings, and they have drawn it and they have brainstormed it and come up with solutions as well. So we did this workshop not alone, but utilizing our change agents. So we made connections. You can see Karine there, Paolo, one of our class fellows. We made connections and utilized these change agents with the faculty members of my own institution to run this workshop and help our participants to get excited about creativity as well. I'm left with a little more than 3 minutes. I'll just quickly go through the slides. But what's the leading cause of death in the US? We know about heart disease, we know about cancer, but medical errors are the third most leading cause of deaths in the United States, taking away life of a number of people equivalent to a jumbo jet every year. The passengers of a jumbo jet every year. We actually introduced appreciative inquiry in one of the tools called as the morbidity and mortality meetings for systems improvement. Our objective was to redefine the processes through appreciative inquiry for systems improvement to reduce medical errors in the emergency room. We have a lot of secondary objectives, including the collaborative environment and adaptive leadership in crisis management. We actually mixed the appreciative inquiry process and the creative problem solving process. Credits to Dr. John Cabra. I emailed him and he obviously got back with these slides. And actually, we did implement actually the same process with our students. This is what they have done. They have implemented the appreciative inquiry in the morbidity and mortality conferences. And these are the results. The highlighted results are the effectiveness of appreciative inquiry, fostering the collaboration and positivity was most positive. But the impact on learning and clinical knowledge, helping reduce these medical errors, showed significant positive results. And this is on the background of a need assessment where a lot of doctors and physicians and nurses thought that the morbidity and mortality conferences are just a blame and shame culture, and we are being, reprimanded for making mistakes. Coming to community service, this was my master's project as well, under the supervision of Dr. Stu, that she was talking about. We call it as the Pakistan Lifesavers Program, making Pakistan a nation of lifesavers by training 10 million citizens in life-saving skills of CPR and bleeding control. We are the fifth largest country in the world. The city where I live in is home to more than 20 million people. What's the survival rate of people with cardiac arrest here in Karachi? Any guesses? I don't have time for any guess, but it's 0%, by the way. None
Oh,
of none of the people from out of hospital out of hospital cardiac arrest survive in Karachi. And this includes the lady in the picture as well. This is my mother who lost her life because of out of hospital cardiac arrest. And that is why I was so passionate to have this program launched in Pakistan. And we did that back in 2020 with a vision to make Pakistan a nation of lifesavers. We went to every corner of the country, reaching every cohort from students to the corporate sector to the law enforcement agencies to the social sector. Every province, every state, we took these life-saving skills. This is one of the world's Restart Hard Day that we celebrated last year, training more than 11,000 people single time in all the states of Pakistan. We brought creativity in, we brought the art in, we heightened the anticipation of our young blood, and they were in to learn these skills as well. Until now, we have trained more than 400,000 Pakistan lifesavers all across the country, also including some of the technology, including the telephone CPR in Pakistan, helping save lives with patients with cardiac arrest and traumatic bleeding. So I'll finish here with this diagram that we started from. The same framework the same WHO framework where we actually connected the knowledge, the core processes and the domains. Now, what we did over the last 5 years in terms of creativity and the work that we did here in Pakistan as per this framework. Pakistan Lifesavers Program and the creative problem solving, you can imagine that running a Pakistan Lifesavers Program, you need to have creative and complex thinking and creative problem solving skills to run this program for 5 years to train more than 400,000 people. So you need to have Pakistan Lifesavers Program and creative problem solving at the bystander site. That's what we are doing. Creativity and education and research through gamification, including the quality of education of the healthcare workers through creative skills and gamification. Quality assurance and quality improvement through appreciative inquiry and morbidity and mortality conferences, and policies and vision through the workshops like creative thinking in the fast lane and creative problem solving, and groundbreaking innovations like the portable MRI, the child healthcare satellite centers, and mechanical CPR. And here I stop my presentation because we are trying to build the culture of excellence through creativity, core processes and domains in emergency medicine in Pakistan. I'll stop here. I thank you all.
well, Noor, I must say, any one of these would have been an amazing creative product. And the depth and breadth and the integration of creativity is just amazing. And it's very, very inspiring. So I thank you for that. We really don't have time for questions. But I know that, you're always available to follow up on some things. So thank you again. The next session starts in a couple minutes, and I've put in the chat the Zoom link to the session that's on creative observations, educators of the gifted, and their perceptions of nonverbal assessment. That's the second one at that comes right after this. So thank you, everybody. Appreciate your time and have a wonderful rest of the day. We also have a closing. One of our students who does amazing programs, large scale, is doing our closing. I have absolutely no idea what we're doing, but I'm sure it's going to be fabulous. So I'm looking forward to that. And again,